In the winter of 1888, patients at St. Bartholomew's Hospital in London began to whisper of something unthinkable happening in the surgical ward after midnight. A surgeon who continued his work long after his patients had drawn their final breath. What you're about to hear is not fiction. This is the documented case of Dr. Edmund Blackwell, a surgeon whose obsession with perfection led him down a path so dark that it would shake the very foundations of medical ethics in Victorian England. Tonight, we descend into the gaslit corridors of one of London's oldest hospitals to uncover a truth so disturbing that it was buried for nearly a century. The year was 1887, and medicine stood at a crossroads. The discovery of anesthesia had revolutionized surgery, but mortality rates remained devastatingly high. In the cramped, unsanitary conditions of Victorian hospitals, death was as common as morning tea. But for Dr. Edmund Blackwell, death was merely an inconvenience, a temporary setback in his quest for surgical mastery. Dr. Blackwell had arrived at St. Bartholomew's with impeccable credentials. Trained at Edinburgh's prestigious medical school, he had spent years studying under the continent's finest surgeons. His techniques were flawless, his knowledge encyclopedic, and his ambition boundless. The hospital administration welcomed him with open arms, believing they had acquired one of London's most promising young surgeons. What they didn't know was that Dr. Blackwell harbored a secret obsession that would soon consume him entirely. The first signs of something amiss emerged in the autumn of 1887. Night nurses reported strange sounds emanating from the surgical theater long after official operations had concluded. The rhythmic scraping of metal against bone, the soft thud of instruments being set down, and occasionally the low murmur of Dr. Blackwell's voice as if he were instructing invisible medical students. Sister Margaret O'Sullivan, the head night nurse, was the first to investigate these nocturnal disturbances. Her journal, discovered in 1987 during renovations of the hospital, provides our most chilling first-hand account of what transpired during those dark winter months. November 15th, 1887. I can no longer ignore the sounds from the theater. Tonight I summoned the courage to peer through the keyhole. What I witnessed defies all Christian understanding. Dr. Blackwell stood over the body of young Timothy Morrison, the cobbler's son who had passed just hours earlier from complications of appendicitis. The doctor's hands moved with practiced precision, making incisions, removing organs, suturing with the care one might show a living patient. He spoke to the corpse as if it could hear him, explaining each procedure in meticulous detail. But Dr. Blackwell's nocturnal activities were far more systematic than simple grave robbing or anatomical study. According to hospital records, painstakingly reconstructed by medical historian Dr. Patricia Thornfield in the 1990s, Blackwell had developed what he called his Posthumous Perfection Protocol, a methodical approach to completing surgeries on patients who had died during or immediately after their operations. His reasoning, as outlined in his private journals, was disturbingly logical. Death, he wrote, is merely the cessation of vital functions, not the immediate decomposition of anatomical structures. The body remains a valid canvas upon which to practice and perfect surgical techniques. If I am to save the living, I must first master my craft upon the dead. Dr. Blackwell had convinced himself that by continuing to operate on deceased patients, he was honoring their memory while simultaneously improving his skills to save future lives. He documented each post-mortem procedure with scientific precision, noting the differences in tissue response, blood coagulation, and healing patterns compared to living patients. The winter of 1888 brought an unusual number of deaths to St. Bartholomew's ward. A virulent strain of influenza swept through London's poorest districts, filling the hospital beds with patients whose families could not afford private medical care. For Dr. Blackwell, this tragic epidemic represented an unprecedented opportunity to advance his macabre research. Night after night, he would wait for the hospital to empty of visitors and administrative staff. Once alone with the recently deceased, he would wheel bodies to his private surgical suite, a converted storage room he had secretly equipped with all the necessary instruments. There, by gaslight, he would perform the operations he believed could have saved their lives. His journals reveal an increasingly disturbed mind rationalizing his actions. Mrs. Catherine Mills, age 34, succumbed to internal bleeding following childbirth. Post-mortem examination reveals the precise location of the hemorrhage. Had I known this during the living surgery, she would have survived. Her sacrifice shall ensure that no other mother suffers her fate. But Dr. Blackwell's activities extended beyond simple surgical practice. He began experimenting with preservation techniques, attempting to maintain tissue viability for extended periods. His private laboratory, hidden in the hospital's basement, contained jars of organs suspended in various chemical solutions, detailed anatomical drawings, and most disturbingly, a collection of surgical instruments specifically designed for post-mortem procedures. The truth began to unravel when Thomas Hartwell, a young medical student assigned to assist Dr. Blackwell, discovered the hidden laboratory during the early hours of March 12, 1888. Hartwell's testimony to the medical board, preserved in the hospital's legal archives, paints a horrifying picture of what he encountered. I followed a strange chemical odor to the basement storage room. Inside, I found what can only be described as a charnel house disguised as a medical facility. Bodies in various stages of dissection lay upon makeshift operating tables. Dr. Blackwell stood among them, his surgical apron stained with fluids I dare not identify, calmly explaining to me that he was correcting the failures of mortality. The walls were lined with preserved organs, and detailed charts documented dozens of post-mortem procedures performed over the previous months. When confronted by hospital administration, Dr. Blackwell showed no remorse or recognition that his actions were aberrant. Instead, he presented his research as a revolutionary advancement in medical education and surgical technique. He argued that traditional medical training, which relied solely on living patients and occasional cadavers from anatomy schools, was insufficient for producing truly skilled surgeons. "Gentlemen," he reportedly told the disciplinary board, "you condemn me for seeking perfection in the service of medicine. Every posthumous procedure I have performed brings me closer to eliminating surgical mortality. The dead have nothing to lose, but the living have everything to gain from my dedication to improvement." The medical board was faced with an unprecedented ethical dilemma. While Dr. Blackwell's technical skills were undeniable and his surgical success rate with living patients was remarkably high, his secret experiments represented a fundamental violation of medical ethics and human dignity. The families of the deceased patients were never informed that their loved ones had been subjected to additional procedures after death. Perhaps most disturbing was the discovery that Dr. Blackwell had been systematically altering death certificates to obscure the true causes of his patients' deaths. When examined closely, many of the patients he had used for posthumous experimentation had died from complications that might have been preventable with different surgical approaches he was perfecting through his nocturnal activities. The investigation revealed that Dr. Blackwell had performed unauthorized posthumous procedures on at least 47 patients over the course of 8 months. His meticulous records indicated that he viewed each death not as a medical failure, but as an opportunity for improvement. He had categorized patients by type of ailment, surgical complexity, and potential for educational value. On April 3, 1888, Dr. Edmund Blackwell was quietly dismissed from St. Bartholomew's Hospital. To avoid public scandal, the hospital administration chose not to pursue criminal charges, instead requesting his immediate resignation and permanent departure from London. The official record stated simply that Dr. Blackwell had pursued research activities incompatible with hospital policy. But the story doesn't end with Dr. Blackwell's dismissal. Hospital records indicate that several other staff members, including junior surgeons and medical students, had been aware of his activities but had chosen to remain silent. Some, according to confidential testimonies, had even observed his posthumous procedures as informal medical education. This conspiracy of silence raises troubling questions about the culture of medical authority in Victorian England. How many other physicians of that era pushed ethical boundaries in the name of advancing medical knowledge? How many families mourned loved ones, never knowing that their bodies had been subjected to experimental procedures after death? Dr. Blackwell disappeared from London following his dismissal, but fragmentary records suggest he may have continued his practices in other cities under assumed names. A series of mysterious incidents at hospitals in Edinburgh, Manchester, and Dublin between 1889 and 1891 bear striking similarities to his methods at St. Bartholomew's. However, no definitive connection has ever been established. The impact of the Blackwell case extended far beyond one surgeon's twisted obsession. The scandal, though largely suppressed at the time, prompted St. Bartholomew's to implement some of the first formal protocols for posthumous medical procedures and body handling. These policies became models for hospitals throughout England and eventually influenced international medical ethics standards. Sister Margaret O'Sullivan's journals, which provided crucial evidence of Dr. Blackwell's activities, also revealed the psychological toll his actions took on hospital staff. Several nurses requested transfers, and at least 2 medical students abandoned their studies entirely after learning of the posthumous surgeries. The trauma rippled through the institution for years afterward. What makes Dr. Blackwell's case particularly chilling is not the grotesque nature of his actions, but the cold rationality with which he pursued them. This was not the work of a madman, but of a highly intelligent, technically skilled physician who had convinced himself that ethical boundaries were obstacles to medical progress. His detailed journals show no signs of mental illness, only a terrifying dedication to what he perceived as his professional duty. The question that haunts medical historians today is whether Dr. Blackwell's posthumous surgeries actually improved his skills with living patients. Statistical analysis of his surgical outcomes suggests that his success rate did indeed increase during the period when he was conducting his secret experiments. This uncomfortable fact forces us to confront a disturbing possibility that his unethical practices may have inadvertently saved lives. This moral complexity exemplifies one of medicine's most persistent dilemmas, the tension between individual ethics and collective benefit. Throughout history, medical advances have often emerged from ethically questionable practices. The knowledge gained from Nazi medical experiments, though obtained through unconscionable means, has nonetheless informed modern trauma treatment. Similarly, the anatomical knowledge derived from grave robbing and body snatching in the 18th and 19th centuries laid the foundation for modern surgery. But Dr. Blackwell's case represents something more sinister than simple ethical compromise for medical advancement. He demonstrated how easily the noble goal of healing could become corrupted by obsession and unchecked authority. He transformed medicine's fundamental mission to preserve and protect life into a justification for violating the dignity of the dead. The patients Dr. Blackwell operated on posthumously were predominantly from London's poorest communities. They had sought medical care at St. Bartholomew's not by choice, but because they could afford nothing better. In death as in life, they were denied agency and respect. Their bodies became tools in one man's quest for professional perfection, their families unknowing participants in an experiment they never consented to join. If you're watching this video, I'd love to hear your thoughts in the comments below. Have you heard similar stories from old hospitals or medical institutions in your area? The history of medicine is filled with these dark chapters that were often hidden from public knowledge. Please share this video if you found it as fascinating and disturbing as I did. And don't forget to subscribe for more explorations into medicine's most troubling past. Today, medical ethics committees, informed consent protocols, and strict oversight procedures exist to prevent cases like Dr. Blackwell's from recurring. Yet the fundamental questions his actions raise remain relevant. Where do we draw the line between medical necessity and human dignity? How do we balance the pursuit of knowledge against respect for individual rights? And perhaps most importantly, who watches the watchers when medical authority goes unchecked? The gaslit corridors of St. Bartholomew's Hospital have long since been replaced by modern fluorescent lighting, but the shadows cast by Dr. Blackwell's legacy linger. Every time we trust our bodies to medical professionals, we implicitly believe that they will honor not only our living wishes, but also our dignity in death. The case of the surgeon who operated on the already dead serves as a chilling reminder of what can happen when that trust is betrayed. In the end, Dr. Edmund Blackwell achieved a form of immortality he never sought, not as a pioneering surgeon who advanced medical science, but as a cautionary tale about the dangers of unchecked medical authority and the corruption of healing into something far more sinister. His story forces us to confront an uncomfortable truth that the line between medical progress and medical horror is often thinner than we dare to imagine. The next time you walked past an old hospital, particularly one with roots in the Victorian era, remember that its walls may hold secrets far darker than anyone alive today could ever imagine. Medicine's greatest advances have often come at costs that history chooses to forget, but the echoes of those costs remain, waiting to be rediscovered